Hello, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System. On November 2, welcome to the month of November, 2020, presenting the 69th edition of our COVID-19 community briefing. As it is a Monday, we have been in the habit of providing the local scoreboard, and I will continue that habit. We'll give you that information right now. Again, general speaking, numbers are up all over the place, and we'll give you some detail with that beginning now. Local scoreboard. In Orange City, at Orange City Area Health System, we've done 5,872 tests. We've had 990 positives, so nearly 1,000 positives so far. That is a rate of 17%. Last week, we had a positivity rate that was way higher than that. We reported 683 tests last week. We had 233 positives. So last week, our positivity rate was 34.1%. So 1 out of 3 tests were positive last week. The week before that, we had 21.9, and the week before that, 14.7. So there's no question we've had a recent spike in this. And so you can expect our numbers to be going up in the aggregate next week and in future reports as well. So 17% local number. Last week, 34% positivity rate. Sioux County, 2,671 positives of 9,982 tested. That is a 26.8% positivity rate. That rate previously was 26.2. The 2,671 positives is 96 more since Friday. Yesterday, as an example, in Sioux County, the tests that were reported to the lab yesterday were 24 positives out of 44 sent in. So that's a positivity rate of 54.5%, 24 of 44. And so clearly our local numbers at 34% last week, the weekend numbers or yesterday's numbers at 54% on a countywide basis are going to point towards our rate in the county going up. And you could certainly expect our 14-day average to go up as well. So let's talk about that. 14-day average. Sioux County is now number 4 in the state at 23.3%. Those numbers previously were 20.4 and 19.8. So as expected, they will go up. Again, expect them to keep going up based on these last couple numbers that I gave you. Plymouth County is number 5 in the state at 23.3%. Those numbers were 20.7 and 20.7 previously. O'Brien County, number 1 in the state, and I believe they were number 1, yes, on Friday as well, at 25.7%. On Friday, they were at 23.2, and a week ago, they were at 20.1. Lyon County, number 17 in the state, 18.7%. So even though they're 17th, they still climbed from 17.5 to 18.7. There are now 86 counties in the state of Iowa out of the 99 that have a 10% or higher positivity rate. On October 19, so just 13, 14 days ago, 2 weeks, that number was 44. So we've gone from 44 to 50 to 65 to 78 to today 86 counties. Very, very steady increase. It gives you an idea of the blanket of which this COVID is covering the state. Region 3, 139 hospitalized in the 20 county region referred to as Region 3. That number previously was 124, and the time before that, 112. So 112 to 124 to 139, going in the wrong direction. The thing that is steady with that, though, is the ICU. All three of those dates that were reported hospitalizations have 20 ICU. So we've had 20 for 3 times in a row. As of today, 9 of those patients are on ventilator support. There have been 17 patients admitted in the last 24 hours in Region 3. Stepping up to the state of Iowa, 131,713 positives out of the 984,539 tested. That is a 13.4%. Consistent theme here, that number's going up. We're at 12.9 the time before this, 12.4 prior to that, 12.2 prior to that. So the state of Iowa continues to climb in the aggregate as measured by virtually all measures here, but certainly supported by the 86 counties now at 10% or higher. The collective rate historically now in the aggregate is 13.4%. There are currently now 624 Iowans hospitalized in Iowa hospitals. That number previously was 564. The time before that, 499. Time before that, 482. So if we go back, a week and a half, that number, 2 weeks maybe, 2 weeks, that number was 482, and today it's at 624. The good news is that that's not so much happening in Northwest Iowa, particularly the 4 counties. Sioux County today has 6 residents hospitalized. That number previously was 10. O'Brien County has 6 also, and that number previously was 4. Plymouth County, 6, previously 7. Lyon County, 1, previously 1. So those 4 counties are really down in terms of the hospitalization, or down in terms of what I refer to as an acuity factor, how sick people are getting. Woodbury County is now tied for number 3 in the state with Dubuque at 43. They are actually down. Woodbury County residents are down from 48, so that's a good Northwest Iowa trend as well. Polk County, number 1 at 57, and they were previously at 57 as well. Lynn County, the new number 2 in the state in eastern Iowa, is at 47. So they've had quite a big jump in Lynn County. So while the hospitalizations are up, while the acuity level is up across the state, we're not experiencing that yet in Northwest Iowa, and maybe we won't, maybe we will, but we'll talk a little bit about that in just a little bit also. Deaths, we've had 28 additional deaths since Friday in the state of Iowa. 17 of those deaths are in Sioux County. Of the 1,733, that's no change. We've had no change in a few reports now in Sioux County. Again, 90% of those deaths are in the age demographic of 61 plus. No change from previously reported. A couple additional notes to discuss. First, regarding Orange City, our Test Iowa clinic, the demand on that clinic is reducing, believe it or not. And so we're moving that clinic beginning today, I believe, from 8 to 9, Monday through Friday. So again, go to testiowa.com, get your QR code, come in, you can have that test, it doesn't cost you anything, and come in from 8 to 9 in the morning, walk in, anytime is fine, no appointment needed. And that's in the west end of our campus, in the physical therapy, occupational health entrance, and the occupational health folks will help you out with that Test Iowa site. Again, you can get that for any reason. You go through, you answer the questions, you get the code, and we can take care of you. In terms of our senior care division, Landsmere Ridge, we're stable enough now out there where we're going to be opening up a little bit, and it'll be a phased opening beginning tomorrow. There'll be some relaxation of our, I guess you could call it a quarantine of sorts. And we're going to be expanding those a little bit again, primarily in the dining arena on Thursday. So if you're involved with Landsmere Ridge, or you have parents or relatives there, go ahead and call Kelly or call Landsmere Ridge, and somebody can direct you through any specifics if you have some questions on that. Once again, last week, we were very fortunate that we had 0 residents test positive at Prairie Ridge, our nursing home. And so we're expanding things a little bit there. We have some chat boxes that we call them. They're the ability to be able to converse with people, family, and we have limitations and rules and things like that to follow. But that's available. We wish we could do more, but we just simply cannot risk that at this point in time. For those of you who are interested in that, and I believe it is close family members, like spouses, children's spouses, that kind of thing, please call the Welcome Center at Prairie Ridge, and the folks can help you with the details. Those are by appointments, but I believe the appointments are 7 days a week. So call to the Welcome Center, get your time slot, and then you'll be able to see your loved one accordingly. Those are the local things. Just a couple things that are going on in the region. Clearly, with the numbers I gave you earlier, this thing isn't over. Lots of positives across the state. My concern is that the acuity that's being experienced in the eastern part of the state eventually migrates this way. Right now, it seems as our acuity has diminished. For example, we have 1 COVID patient in the hospital as of today. That's a very welcome news. And we were up there into the 8 to 11 range over the last couple of weeks. So 1 is a very good number, and we hope to keep it that way or less. 0 would be fantastic. But South Dakota and North Dakota right now are number 1 and 2 in the country. So South Dakota and North Dakota are hotspots, and that's has a strain and burden on the system as well. Emergent transfers are still available. There's been no change. So if somebody needs downstream services that are more than what we can provide, that is still available and is being done. And so that's not the problem, but it does bring to mind again that this flattening of the curve is still very, very important. And it's not, again, to avoid positives. That'd be great if it does, but really what it is to allow the resources to be employed that we have to fight this thing. Again, our therapeutics and ways that we can fight this disease are much better than they were back in March, April, May. We just need to make sure we have the capacity to take care of everybody when it happens. And so right now in Orange City, we're in really good shape. Sioux Falls is being strained a little bit. Rapid City, Watertown, all those places are being strained. Fargo, Bismarck. But emergency services, emergent services are available. More advanced therapeutics are available locally, and particularly here. And so what we need to have happen, and again, keep that curve flat, is for all of you to keep practicing all the things we've been talking about. And so nothing is different there. Broken record time, but please wear your masks. Please practice good hand hygiene in the form of washing 20 to 30 seconds, in the form of hand disinfectant, please do that liberally. And please keep your social distance whenever possible. Again, wearing a mask is imperative, but it does not protect you to violate those social distance things to the extent that you're bulletproof. And so, again, that is one of the biggest falsities, so to speak, of wearing a mask is then I can violate the 6 feet rule all I want to, and I'm safe. You're safer, not necessarily safe. So please keep all those other things in mind also. All right, I'll lift the needle from the broken record. So that's it for today. Big numbers, and every time that I gather this data for this briefing, I'm thinking today the numbers are going to come down. Today was not that day. Maybe Thursday or Friday of this week will be that day, and we'll be happy to report that if that's the case. So that's it. Stay strong, stay vigilant, and stay healthy. Thank you for joining us. We appreciate it.